Thank you. Try this again. Chairman Doggett, the Ranking Member Nunes, as well as all the members of the committee, thank you for holding this important hearing on protecting patients from surprise medical billings. I'm grateful for your leadership to examine this problem so that Congress can work on a bipartisan solution. You know, there's so many stories out there. I was going to share another story of a lady from Washington State who had a massive heart attack and ended up in a surgery hospital in Oregon, which led to all kinds of challenges. And to save her life, she had bypass surgery, a valve replacement and repair. She ended up spending a whole month in the hospital recovering from the surgery, ranging from an infection and needing more powerful antibiotics. She was discharged, and she received her bill. She owed nearly $227,000. So this one was more than a surprise bill. It was massive. It was stressful, and it was devastating. Now, she eventually was able to get help and relief with a complicated medical charity care waiver, but it took 6 months of uncertainty and countless phone calls from collection agencies. It shouldn't have to be this way, especially when someone is recovering from a heart attack. What makes this story even more painful is that nobody told her that she could have been transferred to an in-network hospital, which could have saved tens of thousands of dollars. As she said, there should be fairness and equality in the system. You shouldn't have to file a complaint. This should be ingrained into the system so that when you have a problem and you're due relief, you get it. And she's right. So what's the solution? There must be more transparency. Right now, it is too difficult to be an informed patient. If your care is out of network and you will be charged for it, you should know. I'm grateful that President Trump is making this a priority to end surprise billing. And I agree that this Congress needs to work towards a bipartisan solution. Chairman Pallone and Ranking Member Walden on the Energy and Commerce Committee is also working on this issue to protect patients and keep healthcare costs down. We can end surprise billing and give patients the certainty that they need over their health care. Again, there shouldn't be any surprises. People should be able to trust that they know how much they're going to be billed, especially when they're in some of the most stressful situations of their lives. So thank you, everyone, all the members here today for participating in this hearing. I look forward to working with you and the rest of my colleagues on the Energy and Commerce Committee to address this issue. And I will yield back.
Thank you both.